Hey, it's Dr. Angelina, Georgia Surgery Care Arts, Ideal Body Institute. Today, we're going to talk about skin lesions. Not something you see a lot of cosmetic and plastic surgeons talk about. Mostly it's dermatologists and general surgeons. But it's an important topic, especially now we're coming up to summer. We have to talk about skin protection and how to prevent skin cancer. Skin cancer is one of the most common ones we see. It comes in different shapes and sizes and forms. Anybody can get it. We're all exposed to the sun, and the rates of skin cancer are going up and up and up and up. Most people will approach us, a lot of times looking at moles and skin tags. Moles, something you were born with. Sometimes they just position the places we don't like. Sometimes they start growing as we get older. Some people don't like that, especially it's like right here on the nose or something. But other good reason to map out your moles and skin lesions and monitor them is to decide whether any of them trying to turn cancer. There are a few signs that we always look for, like change in size, change in shape, change in color, if it start getting itchy, ulcerated, like kind of like scab, losing pigment or adding pigment. There are different kind of signs we look for when we decide whether the mole needs to be biopsied, sampled, or taken off completely. When you take out a mole, depends on the type of mole it is, but most of the time we don't want to just shave it. We want to kind of remove it fully. So if you go to the place and they're like seeing mole like this, which is a true mole that I was born with, it's not a skin tag, it's not something developed due to sun exposure, something been there all along, and somebody just says, oh yeah, we can just kind of shave it off on the top. Well, you never got to the root of it, and so you're leaving half of that mole behind, and then if it turns cancerous, you actually might not see it, might not know about it, because it changed its shape. So you really have to make sure it's done correctly. Of course, when it's on the face, sometimes it might leave a little scar, but that's something we deal with, and face heals very nicely. Anywhere else in the body, depends on the size of the lesion. Some of them, like basal cell carcinoma, can grow to be actually relatively large before patients come in, because they think it's a scab, it's a chronic wound, but really it's skin cancer that's growing and kind of ulcerating. I've definitely seen people, even in the hospital, with very large basal cell carcinomas, and they didn't know it was cancer because nobody ever sampled it. So when we remove such large lesions, you have to do it in the right way, and you have to be able to put the skin back together. So there are different kind of reconstructive techniques we have to use to make sure it heals well. Make sure your provider, when we're sampling or taking off the moles, we send them to pathology laboratory where they're going to look under the microscope to make sure we're not missing any abnormality, whether it's precancerous or cancerous lesion. That's going to tell us what to do next, how to remove rest of it, or how to go back and take some more of it out, and how to make sure we monitor you correctly, because if you already had skin cancer once, you probably could get it again. Protect yourself. Remember SPF all the time. Doesn't matter the skin color. My African patients, a lot of times they come in, are using skin, SPF, and they say no. And that's not good, because the skin damage will accumulate underneath the skin and eventually will show up. You can still get skin lesions and moles and skin tags, anything related to sun exposure. Might not look the same way, but it will be there over the time. Proper provider, ask for surveillance. Make sure you have follow-ups. Make sure the samples go to pathology when needed. And stay safe. If you have any questions, let us know. SurgicareArts.com. Same on Instagram, Surgicarearts. Arts. YouTube channel, Ideal Body Institute. Let us know if you have any questions. We'd love to hear from you.